Hi, welcome back to our channel. So this week in the clinic, I had a couple of patients for some reason both report similar things. Just out of the blue, they had some groin stiffness and some tightness there. They don't really know why. It got me thinking, we didn't really touch on this yet in our channel. So today we're going to be talking about some groin stiffness or an adductor pull. You might feel it kind of in this area. Sometimes we can feel it kind of up here also. So stay tuned. If that's what you're dealing with, that's what we're going to talk about. So we're going to start with an active rotation of the hip. We're going to start on our back, and this is going to allow us to control the lengthening of those groin muscles, but also work on some hip stability. A lot of times when our groin pulls, it's because our core and pelvic stability isn't controlled with our lower leg movement, okay? So we're gonna start here on our back. We're gonna work the right leg for this one. So we're gonna start left leg stays straight. Core is gonna stay braced so we don't rock around. We're gonna lift this knee as high as we can, and then we're gonna drop this knee out to the side as far as what's relatively comfortable. A moderate stretch is okay. We don't want a lot of pain. Then we're going to drop it down and try to keep it out, and then bring it back up to neutral, and we're starting again. So we're making circles as big as we can control without rocking around and losing our core. We're gonna control. Nice and slowly, we're gonna do 10 circles in this direction, and then we're gonna do 10 circles in this direction. The next exercise is called a fire hydrant. It's working the similar muscle group, but we're changing gravity. So gravity is now going to be on our backside going down, whereas the first exercise, gravity was facing us this way. So we're gonna start in the quadruped position, and then we're going to start by pulling our knee up again. Then we're going to kick it out to the side, and then we're going to try and make that big circle again and straighten our leg out. So the motion is the same motion we were making for the last exercise, and we're trying to make big circles. I don't want a lot of pain. Tightness is okay. It's called a fire hydrant because, as you guessed, it looks like a dog peeing on a fire hydrant. We're going to do 10 this way, and then we're going to switch directions and kick back first and do the same thing for 10 reps, nice and slow. The third exercise is a side plank. It's going to be a modified side plank. So the leg that we're working, for me, it's going to be my right leg. That leg is going to be behind the non-affected leg, okay? So when I'm here, I'm just gonna place my feet like this. So again, my right foot, we're working my right groin, and it's gonna be behind the left foot. Then what we're doing is we're gonna brace here, and we're trying to push with this right foot down and assist with the left foot. So we're gonna squeeze, and we're just gonna lift up. We're gonna pause. We're gonna count to 5. And then we're gonna slowly come back down and control ourselves. Then we're going up again. We're gonna count to 5. Again, we're trying to work this groin and adductor muscle group here on the back foot. We're gonna repeat that for 10 to 12 repetitions. The fourth exercise is a Cossack squat, or some people call it a lateral lunge. So I'm using a stick here. If you have problems with your balance, or this is going to be really tight and difficult for you, stand on the countertop or use a chair. So we're going to start with our feet relatively wide, and then we're just going to shift our weight over. You're going to feel a little bit of a stretch and pull on that side. We're going to pause for a 1 to 2 count, and then come up, and we're going to switch sides and pause for a 1 to 2 count and come back up. We are working to get full depth to what you can achieve. The standard for this would be able to be doing something like this all the way down. Again, you don't need to do that if you're not able to. We're just trying to actively stretch and dynamically get that groin muscle working. So if you're using a chair, of course, you hold on for support, and then your feet are going to go wide. And again, we're going as low as we can with a moderate stretch, pausing, coming up, switching sides, pausing, coming up. You're going to do that for about 10 to 12 reps on each side. Give these exercises a shot for 2 to 3 sets for a few days. If you're not seeing a lot of change, it might be good for you to check out the doctor's office and have them take further looks at it to see and make sure there's nothing serious going on. If they think you have a different issue, check out our channel, check and find and see if we have a video for one of those and give those exercises a try. Don't forget to like, subscribe, and share. Thanks.